So as we go through our four verbs, we and many organizations across the country have focused for decades to identify low-value care services. We are amazingly thankful from the national and now international leadership of the Choosing Wisely campaign that has now led to scores of professional societies to identify services that are potential for overuse. Some or all of you might know that the U.S. Preventive Services Task Force, which actually identifies those A and B rated services that are mandated to be 100% covered by non-grandfathered plans. They also have services that acquire what's called a D rating, which says that these services are dangerous and should not be used. And so there are a number of ways that we can identify low-value services to get our toe in the water, so to speak, to make a movement to shrink that low-value care iceberg. So Michael Chernew and I created something called the Task Force on Low-Value Care. And we wanted to call it the Waste Task Force, but WTF acronym was already taken. And we assembled stakeholders across the purchaser community, public and private, from across the country. And if you could go back for a second, Michael, we did not want to find the services that were the most harmful. We did not want to find the services that were most dangerous or costly or prevalent. We wanted to start in a baby step way for purchasers to make it easy for them. So the task force went through over 80 services and wanted to go back just one more second, sorry. Go back and identify those that were available to purchasers in forms of their claims, that when they were used, they were mostly used in a low value situation. And most importantly, for the human resources people on the call, is that when we were going to be successful in the reduction of low value care, we wanted situations where the phone didn't ring. Because anyone who's ever tried to remove a benefit of any kind understands that there will be some type of negative reaction by taking something away that has already been in place. So we went around and around and around and around. And the next slide, I think, which is the most important, and if any of you have your cell phones, I would love you to take a photograph of this slide, which are the top 5 lists that the Task Force on Low Value Care chose that would be the easiest 5 services for a purchaser to act on to get moving on a targeted or nuanced low value care campaign. These include diagnostic testing prior to low risk surgery, most notably cataract surgery and breast biopsies, population-based vitamin D screening, which many of you know has been my flagship low value care condition, PSA screening in men over 70, since we wanted to have a Medicare measure, imaging in the first 6 weeks of acute low back pain, as well as a service that Michael tended to mention, the use of branded drugs when an identical generic was available. These we feel are actionable, and it's my hope that the purchasers on the line would choose one of these 5, if not 5 of these 5, to actually follow the lead of Beth and many others around the country to not only identify them, but measure their impact and hopefully reduce their utilization.